Hi, my name's Anthony Glover. I'm an endocrine surgeon and senior clinical lecturer at Northern Clinical School and the Master of Surgery program lead with the Surgical Education, Research and Training Institute, or CERT Institute, at Royal North Shore Hospital. In this talk, I'm going to cover about how to get involved in research at Royal North Shore Hospital. This talk is mainly focusing on junior medical doctors and medical students, but hopefully it will introduce some concepts that are applicable to anyone who is interested in being involved in a research project. So at the CERT Institute, one of the common requests we have from our junior doctors and surgeons is how to get involved in research. So in this talk, I want to think about what research means and how it impacts on surgical practice and how it's different from scholarship, and how you as a junior doctor or a student or a doctor in training can get involved in research at Royal North Shore Hospital. So scholarship is a part of research, and scholarship is an essential part of becoming a surgeon and is part of the core competencies which the college expects surgeons to show in their practice and surgeons to learn as they are training. The key components of scholarship is to show a lifelong commitment to reflective learning and to translate, apply and disseminate new medical knowledge. This is obviously critical for our surgical practice, for us to get the best outcomes for our patients as we understand more about surgery and more about the natural biology of the different illnesses we treat. As part of scholarship, there is also the component of education and with teaching, supervising and improving surgical practice of ourselves and also those around us. So as a junior doctor or a student, you can develop your scholarship by questioning what is happening around you, by having a critical mind, by attending and participating in the different meetings that are run at Royal North Shore Hospital. Especially with the grand rounds or MDT meetings, journal clubs, or other meetings for different specialties. Part of scholarship is understanding critical review and appraising journal articles, and thinking how you can implement changes to the practice you see and also to your further practice. A key part of being a successful scholar and also being successful in research is being able to understand the literature. This is critical as it allows you to appraise evidence critically and see how useful it is to your clinical practice, and also allows you to identify gaps that there may be in the literature which your research can address. Addressing these gaps and having a good research question is probably the most important part of deciding on a research project. So scholarship is related to research, but it is different. And if you're doing research, you're really trying to see how you can create knowledge and address gaps that are in. So the type of research you can get involved in is varied, and at Royal North Shore, you will see many different surgeons and very many different units involved in different type of research. Generally, research can be original, so creating new knowledge, or a review, so summarizing the current knowledge, and can take part in a number of areas. It can be clinical research, so the study of health and illness in people, such as case series or clinical trials. It can be health outcomes research, so study of how systems affect patient care. It can be basic science and translational, so either trying to discover new things in the laboratory or translate these discoveries to patient care, or educational research, which looks at how education and training processes shape educational outcomes. So how do you decide on a research project? There's a number of different steps, and I'm just going to give you some personal opinions that I have about how I think if you are thinking about a research project, what work you should do before you start your project, and some tips to try to ensure that the research project will be a success. I think as a junior doctor and a student, the key initial step is to find a good project and a supervisor. And finding a supervisor and starting a project, I kind of see it as running a marathon. If you've never run a marathon before, you don't just get out the day before and run the marathon. It takes a lot of planning and a lot of training, and completing a research project is similar in many ways. You need to think about what research skills you need. Do you have any experience with stats or analysis of data? Will you need that for this project? Are there members of the team who may be able to perform that for you, or will you need to be able to get those skills yourself? Some ways that you may look at getting those skills yourself is through different subjects which are offered by different universities, such as Sydney Uni with their biostat subject, and another of other forums. Finally, you need to learn how to write and present. Often writing and presenting is something you may not have had that much experience with, and these are skills you need to develop to have a successful project published. For a project to be successful, I think it's critical to think about what your goal is with being involved with this project. Is the goal to learn more about the topic or the specialty, or get experience of working with a clinician or a team? Or is your goal to complete a project to present it at a conference or publish a paper? It is critical that when you go into a project, you think about what your goals could be. You may have multiple goals, which is fine, but it's important that you talk to your supervisor and your team about what you want to achieve with this project. If your goal is to publish a conference presentation or publish a paper, the research will take time. So how much time do you have? For publishing a paper, it may take well over a year when you start a project to when it's submitted for publication. Obviously, if you're only in your term for a few months, you need to make that clear to your supervisor and your team, and be realistic about what you can achieve. One way to think about if the team and the supervisor is a good fit for you is looking at their track record. So on the CERT website, each specialty has a listing of each individual consultant. And if you look at each of those consultants, you can see what their publications are, what kind of projects they are involved in. If you're seeking to publish a paper or a paper in a specific journal, if you're working with a team that has never published a paper in that journal before, it's probably going to be more difficult to complete that project. So think about the track record of the team of what you're joining. In research in general, the past performance is predictive of future performance, with the caveat that if a researcher is early in their career, they may have more time to spend with you if you need that for your project, rather than a very established researcher who may need that you are more self-sufficient in your research. So it's worthwhile thinking about all these factors when you're deciding on your project, and learning about the different teams that would be available to work with you on your research project. When you find a team and decide on a project you're interested in, think about what the aim of the project is. The research question is critical to how successful your project will be, especially if you want to publish it. Think about what is the endpoint or the outcome you are looking at. An endpoint might be survival of a patient or a lab test, or it may be a clinical indication such as readmission rates or infection rates. When you're thinking about this, ask, is it feasible for you to collect this information from the data you have or from the resources you have? I think it's also worthwhile asking, is this question something that interests you? Often with research, it can take time, and it requires determination. So if it's a project you're not really that excited about or interested in, then perhaps it's not the best project for you to start with. Once you've decided on a question, it's critical to think about if this question is answering a gap in the literature. So look at what papers have been published about the topic, and if your question will add anything to these questions or provide a different viewpoint. If you want to publish your research, it's important that the research is not just a confirmatory study. So an example may be if you're looking at a common surgical operation and you're doing a project that this reports outcomes, that's probably going to be quite difficult to publish. But if you're looking at a new technique or a new technology and how it is used in that operation, that is much more likely to be a paper that a journal will want to publish. A key part of the research project is the research journey. And as you go on in your project and when you start, it's worthwhile thinking about what research skills you need. You need to think about what the ethics is. Hopefully this may already be prepared by your research team, but if it is not, it needs to be obtained, which is essential for any project. You need to know how to collect data, ideally how to do the stats yourself or have an understanding of that, and also a plan as to how you will analyze your data. And think about what special skills will you need. If you've never written a paper before, it may be worthwhile looking for courses about how to write a paper. Or if you have never done any stats before, looking at stats courses that provide the skills for you to develop your own project. Any research project is a journey, and it's important that you avoid the traps. So I think communicating and ideally meeting regularly with your supervisor and team is critical. And if your supervisor expects you to ask you to get in contact with them, don't just go silent. There's nothing worse than a supervisor giving a project to a keen student and asking them to present the progress in 4 weeks and then having not heard from them at all. The supervisor will think that either you're not interested or you're giving up on the project. So it's worthwhile always keeping regular contact with your team or supervisor, even if it is just an email to say what you're up to or if you're having any problems or if you're being busy, just so they know what you're up to. When you initially collect your data, it's worthwhile reviewing that to see will your data answer the question you're asking, and discussing this with your supervisor and team. Any problems or unexpected findings, you should identify them early, and it may be possible to change or adapt the project to address these problems, which is a lot easier at the start of the project rather than at the end when the final manuscript is being prepared. Research and being successful in research takes practice. So as I said before, it's worthwhile thinking about learning what skills you need to do. Writing a scientific paper is a skill which you can easily learn. Professor Amanda Salis from University of Sydney holds a number of very successful workshops, which I'd highly recommend, which you should think about doing when you have your data collected and you're at the stage of writing up your paper. Also present as much as you can and look for opportunities to present. It may be to your department, to your other medical students, to grand rounds, to state or national, international meetings. The more you present, the more feedback you will get for your project, and the more value you'll gain for your research. It may also be possible to apply for different funding, such as travel grants for your project, which will look great on your CV and allow you to attend different meetings. So I think being successful in research and how to get involved in research, you need to think about what skills you need and how you can address them. Either it may be with a higher degree, or it may be just be doing a course or doing some reading. Get your research out there, publish and promote it, present it, find effective team members who may become your mentors or sponsors. And think about joining specialist societies So some societies I have been involved with, the section of academic surgery through the Royal Australasian College of Surgeons and the Association for Academic Surgery, which is based in the US. And there will be many other societies for your particular specialty. If you really want to get involved in research and you want to make it a significant part of your career, think about a research degree. And one part of being successful in research is that you have to get used to failure to achieve success. You will get rejection for some of your papers and some of your presentations. It's part of being a researcher, and as a clinician, it can be quite different to have this kind of feedback, but it is part of being a successful researcher. So it is worthwhile to embrace it and see how this feedback can be used to further strengthen your project. So I hope this lecture has helped you think about how you can get involved in research at Royal North Shore Hospital with the CERT Institute and with the different teams at Royal North Shore Hospital. I think being involved in research, it can make you a better surgeon and a better doctor. And it allows you to better understand the literature and think about how you can change practice and monitor effect of these changes. Getting involved with research requires a lot of planning. It requires skills, time, some luck to be successful, and a good supervisor and team. So I hope this lecture has helped you think about how you can develop your projects during your time at Royal North Shore Hospital and during your surgical career. So you're interested in finding out about more research that's done at Royal North Shore Hospital, I would recommend you check out the CERT website, which is at surgery.rnsh.org. And if you have a look at the surgical departments, you can see the different specialties that you're interested in and the different consultants. And if you look at their profiles, you'll see the different publications they have or the different projects they're involved in. Another great resource on the CERT website is the research guides, which goes into more detail about many of the things I have talked about, such as how to make a good research question. So I'd highly recommend checking out that section. And if you have any other questions, we're always happy for you to contact us at the CERT Institute, and we would be happy to give further advice. So I hope your research projects go well at Royal North Shore Hospital, and I look forward to seeing lots of presentations and publications in the future.